has some
Yeah.
core concepts, but some customizations that applies to like different individuals, different levels.
So in a dental office, I think that one of the common breakdowns is a lack of communication within the office. And every office I've gone to, hundreds of them, everybody says, oh, yeah, we're great communicators. We don't even need a team meeting because we talk all the time. What it is you've got these isolated conversations between two people or three people. And oftentimes the front office is on a totally different page from the back office. And so establishing great systems is something that's critically important to any single practice, but it gets even more important as you try to scale. If you have systems that are repeatable and easy to train people on, then you're screwed. It's not going to work for one or 10 or 100 practices any better. Establishing that in an office, that front to back communication, and that comes through really effective patient transfers, which is something I preach daily in my offices. And then when they got it, I preached it weekly. And then we got to a point where we preached it monthly, but then we'd circle back if we had any issues, making sure patients were transferred with full communication and a full understanding for the next provider who's, taking that patient on. And the patient hears the same story 4 or 5 times in their visit. Well, guess what? There's very little room for confusion. There's really very little room for miscommunications. There are very few times where a patient comes in and says, what are we doing today? Or wait, I thought I was getting my teeth cleaned. Because everybody's on the same page. So those transfers, a weekly meeting where you dive in and make sure everybody's on the same page globally as a practice. But then just as importantly, every morning, you got to set 10 to 15 minutes aside for a team meeting going into the day where you review what happened yesterday, what went well, what didn't go well. What's going on today? Where are the bottlenecks? Where are the opportunities? Are we scheduled the goal? Where can we fit an emergency patient? All of those things make your systems run more smoothly and more predictably, which decreases stress for everybody, makes the patient experience a hell of a lot better. And by the way, it makes the practice a lot more profitable. And then you look at tomorrow and anticipate issues there. And so the communication element is really what leadership is all about. And establishing those systems of communication in addition to all the other systems that keep the trains running on time. If you don't do that, then, you're not going to do very well.